Good morning. I am Raquel Gradney, and I will be giving my input on the cost analysis of the Affordable Health Care Act. When discussing the Affordable Health Care Act, the main purpose of it was to provide health care to everyone so everyone can have access to health care. When looking at the cost analysis, I find that many people don't understand how much health care costs. We come from a world that for a long time that it has been that you have insurance or you don't have insurance, and when you have insurance you go to the doctor or the hospital and you pay a copay, and then that's it. Everything else is covered through your health insurance. And then for those who don't have insurance, you go to the hospital because you need treatment and you don't have to ultimately pay for it. So whenever you're starting to add millions of people to a system that currently doesn't work perfect, you are just adding more people to a broken system, and ultimately someone has to pay for it. I find that the biggest problem with this is that many people don't understand actually how much healthcare costs. In an article that was written by Miss Fontenot, the name of the article is Affordable Care Act Lifting the Curtain on Healthcare Costs, it discusses how blind people truly are when it comes to the prices of healthcare, and then also how many people, even with insurance and without insurance, they desire the quick fix instead of taking certain stages to possibly get better. And one of the examples was talking about a CEO who fractures his knee on a morning run, and he chooses to just go and get cortisone shots instead of going do therapy sessions that could also provide him with a relief and help him get better. And then we also have patients that go to the doctor and they may think that their child has an ear infection and they want antibiotics, but whenever the doctor examines them, they find that they do not have an ear infection and not running fever, so the child does not need antibiotics. So as healthcare providers, we have to be cost conscious and explain to patients that if you don't need antibiotics, then I'm not going to prescribe you antibiotics. And sometimes that puts us in a bind, because do you prescribe something to make the patient feel better about it mentally, or do you not prescribe something and let certain things run its course on its own because you know that it's cost conscious? Also, whenever you see this in the hospital, if a patient had a CBC the morning before and the CBC was fine, do you just order a CBC just to order another one, even if it's not totally warranted? So it's important for not only healthcare professionals to be cost conscious, but even as Americans and who strive to receive healthcare, we need to be cost conscious as well and have realistic goals. A lot of times the problem is that we want so many things and we look for that quick fix that sometimes some things and some treatments can be done at a cheaper way, and we need to be aware of these things. There's another group called the Partnership to Fight Chronic Disease. Its article is entitled 130 Americans with Chronic Disease Cost More Than 2.5 trillion annually. It's a big issue as far as in treating chronic diseases, because many of chronic diseases are preventative. So healthcare reform needs to really inform patients on the importance of preventative and wellness treatment. Many times, there's somebody who's a borderline diabetic, and they choose to not eat the right things and exercise, and then they end up going into the hospital, in and out, and have this chronic disease for the rest of their life, when this is something that could be prevented if that person decided to make the right choices. Because these type of things, chronic illnesses, they contribute to a lot of where our healthcare money is going to, because these patients require extensive treatment and they can be in and out of the hospital, whereas they also desire the quick fix, where you find that I think everyone's come encounter with someone that has a chronic condition and they constantly go in and out of the hospital, and you don't understand why they don't make the right healthcare choices and things to change their life. But I think if they understood and knew how much that it actually costs for their treatment, that they would make those decisions to change their life. we have to ultimately get away from looking for quick fixes and look for more long-term fixes in the sense of the person with diabetes. Instead of just coming in and making insulin changes and increasing those type of things, we need to teach and promote more wellness and see if possibly they would benefit if they change their diet and exercise level, that this could affect their lifestyle tremendously. This is also an issue with cost because of the health care that we can provide, many people are living longer. So they have a risk of having these chronic illnesses for, until they're 80 or 90, however long they live. And if they're continually in and out of the hospital, this is, increasing the cost of health care because of those chronic illnesses. The Partnership to Fight Chronic Disease really wants political personnel to voice these opinions and discuss and tell people about wellness and prevention, because it is very important. Because if chronic diseases are costing us this much, if we could help patients with chronic diseases and provide better management and prevention of patients getting these chronic diseases, this could cause a drastic change in the amount of health care. And also we could provide incentives to people living healthy lifestyles. I always find that if someone is provided with something, whether it's a cheaper deductible or not having to pay as much whenever you go to the doctor or the hospital because you're living a healthy lifestyle, that gives people something to work towards. So I find that providing incentives and then also just information and providing knowledge on how much healthcare costs, this could really help. Because if you're having to see how much something really costs, this will be an eye-opener for everyone to say, well, maybe I should live healthier, and not technically, people be penalized if you're not healthy. But if you can show that you're, trying to live a healthy lifestyle and doing the right thing, then, you receive those incentives whenever it comes to paying for health care. But also, this is such a touchy subject because there are so many things and so many options for it, where the video really helped to display those things as far as as far as providing health care to everyone. And it sounds great and it's wonderful if it all eventually works, but there's so many little things that need to be done. We need to focus on what's costing us the most now, and it definitely shows that chronic illnesses cost us a whole lot. So to prevent chronic illness, prevention and promoting wellness would be extremely helpful. As far as the three things that I learned the most this semester, I always found that I never really enjoyed the political aspect of healthcare, just because I really didn't understand it. And whenever the Affordable Health Care Act was just getting started and talked about, it was one of those situations where I was like, oh, well, they're going to do what they want anyway. That's not going to affect me. I'm just going to work as a nurse. But really and truly it does. I was very blinded by it because I didn't understand it. But now, after this course, I understand it, and especially as being a future nurse practitioner, I see that it is something that will affect me, because I want to be someone to be cost conscious as a healthcare provider. And it is important to know these things and to understand how they work politically. So just being provided with more information and understanding of the Affordable Care Act and just the political side of healthcare has been extremely beneficial to me. Another aspect that I thought was important this semester was the importance of getting involved in national organizations. Many organizations such as the AANP represent and advocate for nurse practitioners in practice and for our patients. And I feel that this was also something that I thought was important, but I never really understood it as, being something that I had to do. Whenever I was in undergrad, I always felt that, it seemed like it was optional to join these professional organizations. But now I see how vital it is to join these organizations, because they do so much for our practice, and what they do can really expand the role of the nurse practitioner. And lastly, the third most important thing I enjoyed about the course was the video on John Q. Whenever I first watched John Q, I was in high school, and I just watched it because I enjoyed Denzel Washington and, action type movies. And so I had a totally different perspective on it whenever I watched it this time, because before I didn't have any background in healthcare, and I didn't have any children either. So it just was an interesting action based drama type movie. But now I have a better understanding of it, and it made it more difficult and actually means so much more to me, because after working in healthcare and, even working with patients who are on a transplant list or don't have insurance, you pretty much can see both sides of the situation. Whereas, I related to the father wanting, his child to get treatment, but then I also knew the medical aspect of it, of how it's not easy to do those things. And a lot of times those type of things do not happen instantly. Even if you have insurance or don't have insurance, there are so many things that we have to go through to get those type of things done, and procedures that you have to go through, leaps and bounds to do those type of things. So I was able to relate to the healthcare provider side as well, even though at some points in times, I felt like, things could have been done differently in the movie, but I was able to relate to both sides. But it made me understand more how, ethical dilemmas are something that we are faced with quite often in healthcare, and we have to, be knowledgeable and understand and be ready to make those type of tough decisions whenever you get faced with them. I really enjoyed this course. It was something that I did not expect that I would eventually enjoy, just because I felt like I just never liked to put business and healthcare or politics and healthcare together. I always felt like I just, enjoyed treating my patients, but it's nice to get the background on how everything works and how it all comes together. Thank you.